Hi, we're going to take a few moments to talk about mental health screening, go over the instruments that we're going to be using to help our screening participants, and some of the resources that exist in the greater Charlottesville community that they can use for care and connect them with mental health care. So we will be using this, it's a compiled screen using multiple instruments, 4 instruments total, that comes from the National Depression Screening Day. Of course, you can use these instruments on any other day, which we'll be using for this particular screen. It has the HANDS depression screening tool. It has a screening instrument for generalized anxiety disorder, an instrument for mood disorders to detect bipolar disorder, and an instrument for PTSD. Now, I want you to stress to the screening participants that these instruments do not diagnose. These are simply numbers that help us guide participants that may be at risk for these particular disorders: bipolar disorder, depression, PTSD, or generalized anxiety disorder. And on top of that, I would also suggest that when talking to screening participants, that you make a connection between emotional and mental health and physical health. Some of the participants that you'll be speaking with on the screening day may have never seen a psychiatrist, a therapist, or talked about their emotions with their primary care physician. So if you mention to them that depression can have an effect on your cardiovascular system, on high blood pressure, on diabetes, the generalized anxiety disorder can put you at increased risk for stroke or heart attack, that may make a more profound connection for the screening participant. So, now that we've talked about the instrument and what it consists of, exactly how do you deliver it to the participant? So these are designed for the individual to read themselves and fill out on their own, and ultimately the screener can go back to a scoring sheet and see if they meet the cutoff for at risk. And some of the participants may have difficulties with reading. If that is the case, feel free to help them through reading to them the different items on the screening tool, and then giving them the options for what best describes the frequency or whatever the measurement is for that particular symptom. That's perfectly okay to do. There are questions at the beginning of the screening instrument that talks about age, gender, marital status, and so forth, that you can collect that information in the beginning as well. This is the scoring sheet for the instrument that is very, very simple and spells out directions in a very straightforward way for the screener to go through and add up different scores to see if the participant does meet an at-risk level. Again, just to reiterate, these are not diagnoses, they simply describe risk. Now, ultimately, the entire purpose of a screen is to identify participants who could benefit from being connected with care and to catch different disorders early, in this case, mental health disorders. So we have compiled a list of different sources, different resources that exist in the Charlottesville community. That may be day programs or different healthcare agencies that are very experienced with working with these particular patient populations and can connect them with the care that would benefit them. We also have for you to hand out to participants a suicide risk card, and on this card it identifies the National Lifeline for any participant that may feel they're having suicidal ideation and need someone to talk to emergently. Within the card you can find a number of risk factors and guides to help you in making that assessment. So make sure to give one of these to every participant that comes through as well. These can often be very sensitive matters to discuss with folks, in this case the screening participants. So we want you to know that you will be supported. There will be a psychiatrist at the screening, and if you ever feel there is an instance that is outside your scope of comfort, please don't hesitate to contact someone else to contact the physician supervisor and say, I need a little extra help with this participant, what are your thoughts? In the event that a participant does mention to you that they are currently having suicidal thoughts or homicidal thoughts, this is an urgent and emergent matter, really, and please also discuss this with the psychiatrist on site as well, or any physician on site. Thank you.